So the last presentation is by video from Baris Demiral, who works with Nora Volkow. And after that, we have time for questions and discussion.
Good morning, OHBM. This is Sukru Baris Demiral from Laboratory of Neuroimaging, NIAAA, NIH. Today I would like to talk about the effects of stimulants on brain function and dopamine receptors, basically, and the association between two, and how also the stimulants like methylphenidate influence blink rates, behavioral measures, and association between glucose metabolism and functional connectivity in the brain. I hope you enjoy my talk. At the Laboratory of Neuroimaging, NIH, we use multimodal imaging techniques. We use fMRI, functional and structural. We use PET cameras using NLC and raclopride, carbon-11 or FDG, F18 PET scanning techniques, and also we use methylphenidate, as known as Ritalin, as a stimulant to see how striatal reward regions in the brain are modulated by this drug. In generally healthy controls, as well as opioid, alcohol, and cannabis use disordered group of subjects. In the MR scanner, we can also implement eye tracking. I hope you will enjoy my presentation, which combines all of these methodologies. This is an example design, example protocol, where we generally have two sessions, day 1 and day 2, and in the first session we generally collect D1 receptor density via NNC PET scanning, and then in the first and the second session we also have D2 PET scanning by raclopride. This comes actually after either giving placebo in one session or methylphenidate in another session, which can be either drug, pill, or intravenously delivered to subject, bolus injection. After this, we take subject to the MR scanner, and then we just look at the resting state, and also task based images are collected. Why methylphenidate? Because methylphenidate is a catecholamine reuptake inhibitor, so it just blocks the uptake of the dopamine neurotransmitters, which increase the neurosynaptic density of the transmitter. So postsynaptic dopamine receptors receive more receptor activations or impact of the dopamine neurotransmitters increase. That's why, for instance, we need to look at some of the effects of, like, say, eye blinking. Methylphenidate plays an important role, because by this way we can confirm and replicate or just test with the previous blink rate and dopamine system associations reported in schizophrenia particularly are still valid, and improve those old findings in some ways. In this study that I'm presenting first is that we looked at the eye blink rate changes due to the methylphenidate, and how this change and blink rates related to D1 and D2 receptor availability or densities. As you know, mammals, we all blink, and it may go all the way to mud skippers, some form of blinking to clean up the eyeballs, and also this blink, either intentional or reflex-wise. This is a complex network of activations in our brains and subcortical regions. When we gave methylphenidate to subjects, the methylphenidate session, the eyes closed times reduced, indicating that in the resting state, people kept their eyes more often, and the blink rates also decreased. Note that these blink rate measures are done in the MR scanner while people are in the resting state scan. On the left side, you see the nucleus on the D1 receptor densities and then CT scan in both the methylphenidate MP session and placebo session across subjects. So blink rates were more correlated with the D1 receptor densities across subjects in the scautate region, which are actually shown as voxel cluster in this depiction of the D1 receptor density SPM significance. And on the right side, we also reported D2 receptor densities, and interestingly, again, the methylphenidate session blink rates were across subjects was more correlated with the D2 receptor densities in the methylphenidate session, in particular putamen. Overall, this initial findings showed that when we give methylphenidate, the blink rates and its correlation with dopaminergic system is more likely to be visible. So actually methylphenidate bring up the dopaminergic activity levels more comparable with blink rate measures. This is more related with the dopaminergic system and the receptor activations. The next question we asked was this change in the methylphenidate to placebo blink rates can be estimated from the baseline or placebo dopaminergic receptor densities. And when we look at those, we saw that only D1 receptor densities are highly predictive of the methylphenidate induced blink rate changes. These results indicated that D1 is a more predictive system to understand blink rate changes. So this study mainly focused on the relation between the behavioral and the dopamine system, which actually showed preliminary results of the impact of and importance of the D1 system. We followed up with a new analysis of the same protocol where Wei-Zheng Yan demonstrated that in visual spatial task conducting the dynamic functional connectivity analysis and finding the important resting state and the task-based state the states in the dynamic states in the brain, he was able to extract three important measures: fractional occupancy, dwell time, and appearance. So when he looked at these in different networks, which he extracted from the analysis, particularly frontoparietal network and somatomotor network and visual network, he was able to depict the methylphenidate induced changes in particularly in dwell time and fractional occupancy measures in frontoparietal network, and also these changes kind of disappeared in the other measures. But looking into more combining the dopamine receptor availability, particularly D1 receptor availability in putamen, caudate, nucleus accumbens, we have shown that the change of dwell time in frontoparietal network was positively correlated with the D1 receptor availability. And this D1 receptor availability was also have an intricately important relationship between the performance reaction times and also the dwell times. So Weizeng successfully demonstrated that by using dynamic connectivity approach, it was we were able to show the relationship between the receptor densities and state changes and behavior, which actually emphasize again the D1 receptors, importance of receptors. In parallel, we were also conducting a combined simultaneous PET fMRI study similar to the previous studies that I showed you, but this time combined recording, but was followed by either IV or oral methylphenidate injection, given the fact that IV methylphenidate should be acting very fast manner. Peter Manza, who conducted study, hypothesized that when we ask people how high do you feel, this feeling high result should be more pronounced for IV injection rather than oral drug. As he predicted, there was more high ratings for the IV methylphenidate, and he then asked this question: why high and why IV methylphenidate and subjective high ratings are so related? He hypothesized that this might be related to D1 receptor densities, such that low affinity of the D1 receptor compared to D2 receptors might need big surges of dopamines to stimulate, and that's why when people are stimulated, they are more likely to rate high due to the D1 receptor density and availability. And that's what he was able to show here, is that the red dots here show the D1 receptors, and the D1 receptor availability, the higher it is, feeling high in the methylphenidate situation versus the placebo situation. And in the D2, this relationship didn't hold. So again, D1 receptor density turned out to be important for subjective ratings. One last thing about the study is that he was also able to show that the fast IV intravenous methylphenidate increased the ACC activation by decreasing the ventromedial PFC activation. The last study I want to talk about is the study that we conducted looking at the thalamic metabolism and thalamic functional connectivity in cannabis abusers and health controls. In this analysis, we partitioned thalamus by using Behren's atlas, and we use methylphenidate and placebo orally, like the previous experiments I mentioned. However, this time we don't use dopamine PET, we use PET FDG, looking at the glucose metabolism. First thing, we found out that the motor seat region and the sensory seat regions of the thalamus had connectivity with cerebellum, which change due to methylphenidate. So this one is the cerebellum target ROI against cerebellum target ROI for these two motor and sensory thalamic seat regions. And this was significant, and methylphenidate increased this connectivity. However, methylphenidate had an inverse effect on the third connection we found, which we found the premotor region to nucleus accumbens, left nucleus accumbens region, which was much smaller, which is actually kind of inverse correlation, negative correlation, and which actually normalized by the methylphenidate for the cannabis users. As you see, this negativity decrease, and it's kind of became like normal health controls, placebo condition. On the other hand, this effect was reversed for the healthy controls, indicating that methylphenidate does not have the same effect on everybody, and depending on the status of the receiver, like ADHD or CUD, these normalization effects may happen. Following this, we also looked at the methylphenidate's effects on glucose metabolism. What you see here is that at the target ROI, like cerebellum, and nucleus accumbens ROIs, we were able to show that methylphenidate increased the glucose metabolism, but it did not increase glucose metabolism on the nucleus accumbens ROI, and we also showed that health controls had higher glucose metabolism compared to cannabis abusers. Plus, the change in the FDG, absolute FDG, in both target and thalamic seat region was positive, as expected. However, for the nucleus accumbens region, this change was not very positive. However, generally we do see that if people have lower thalamic FDG, they were more likely to have lower target FDG, target ROI FDGs as well. So overall, there is a strong integration of dopaminergic system, stimulant-induced behavior, and both changes. We show that generally D1 system is mainly the major system that is influencing those behavioral changes, and we also show the D1 system's effects on IB links, visual task performance, subjective ratings, and connectivity. On the other hand, glucose metabolism was found to be region-specific, and also depending on the receiver's characteristics, like different participant groups had a different influence by methylphenidate, glucose metabolism, as well as connectivity changes. Overall, using PET and MRI under stimulus challenge can be a very useful method to understand brain function and the effect of stimulants and drug function. Thank you.